All right, let's dive into a really common and powerful medication called Rivaroxaban. Now, if you've ever heard the term blood thinner, well, we're about to explore one of the most advanced examples out there in modern medicine today.
Let's just start with that idea, right? The prevention of something truly life-threatening. I mean, imagine a single pill that could intercept a dangerous chain reaction inside your own body and stop a devastating clot from ever even forming. That's the powerful concept we're talking about here.
So to really get a grip on how this medicine works, we first have to understand the danger it's built to fight. Not all blood clots are bad, of course not. They're absolutely essential for healing a cut. But when they form inside your blood vessels where they shouldn't, they become these silent threats.
And we're not talking about just any clots. These are harmful formations called thrombi. Think of them as internal clots that can cause absolute chaos. A clot that travels up to the brain, that can cause a stroke. If one gets lodged in the lungs, that's a pulmonary embolism, which can be deadly. And if it forms deep in the veins of your leg, that's a DVT, which is not only painful, but it's often the starting point for clots that decide to travel.
And this is where our solution comes in, Rivaroxaban. It's an oral anticoagulant, and it's part of a newer class of drugs you might hear called DOACs, or Direct Oral Anticoagulants. Its entire job, its whole purpose, is to stop those dangerous clots from forming in the first place. It basically acts like a guardian for your blood vessels.
So how does your body even form a clot naturally? And more importantly, how does this drug so cleverly step in and stop it? It's a pretty fascinating process, almost like a biological chain reaction.
Okay, so think of your body's clotting system. It's called the coagulation cascade, like a really complex line of dominoes. When one gets tipped over, it triggers the next, and then the next, and so on. Well, a super important domino right in the middle of this whole chain is a protein called factor XA. That's factor 10A. Once factor XA gets activated, it's the thing that kicks off the final steps to actually build the clot.
This is exactly where Rivaroxaban comes into play. It has one very specific mission. It doesn't just mess with the whole system. No, it's a selective inhibitor. It precisely targets that one factor XA domino and essentially pulls it out of the line so it can't fall and trigger the rest of the chain.
And the result of that is pretty clear. By blocking factor X, the entire domino effect grinds to a halt right before the final clot can be built. Now, it's really important to know it doesn't break down old clots that are already there, but it is incredibly good at preventing new, dangerous ones from ever taking shape.
So who actually needs this kind of protection? This drug isn't for just anyone. It's prescribed for some very specific and critical missions, where the risk of forming one of these harmful clots is really high.
For instance, it's used to prevent strokes in people who have an irregular heartbeat called atrial fibrillation, or AFib, where blood can pool in the heart and form clots. It's also a frontline treatment for DVT and PE. Plus, it's used for short-term prevention after major surgeries, like a hip-on-knee replacement, which can really increase clot risk. And, at a much lower dose, it helps protect patients who have artery disease.
And as you can see right here, the dose is not one size fits all, not at all. A doctor very carefully tailors the dosage for whatever that specific protective mission is. So a patient with AFib takes a totally different dose than someone who just had knee surgery, or someone who's being treated for a clot that's already there. Getting that dose right is absolutely critical for it to be safe and effective.
And here's a small detail, but it is so important. For the higher doses, the 15 and 20 milligram tablets, taking them with food isn't just a suggestion, it is essential. Food actually ensures that your body absorbs the full dose of the medication so it can do its job properly.
Okay, now we have to talk about a very important part of this story. We've talked all about the power of this drug to stop clots. But that very same power, that's also its biggest risk. It's a classic double-edged sword.
You see, this is the fundamental trade-off of any blood thinner. By lowering your body's ability to form clots to prevent, say, a stroke or a PE, you are inherently increasing the risk of bleeding. The entire therapy is a carefully calculated balancing act. And because of that risk, knowing these warning signs is a huge part of using the medication safely. Things like unusual nosebleeds, or seeing blood in your urine or stool, or having a severe headache. Those could be signs of serious bleeding and mean you need to get medical attention right away.
So, with this constant balance of benefit and risk, how has a drug like this changed the game compared to the older medications? And maybe more importantly, what kind of safety nets do we have in place for those rare but serious bleeding emergencies?
Well, when you compare to the old standard, warfarin, you can really see what a revolution this is.
For decades, if you were on a blood thinner, it meant constant blood tests, sometimes every week, and you had to watch your diet so carefully because even a salad could mess with the medication. Rivaroxaban gets rid of all those burdens. It offers a kind of freedom and quality of life that was just unimaginable for patients before, and it works fast, which is a massive advantage.
This is probably the most important question for anyone taking an anticoagulant. If there's a major accident or a serious internal bleed, you've got to have a way to turn the drug's effect off and fast.
And thankfully, there is an answer. A specific antidote exists called andexanet alpha. The way it works is brilliant, really. You can think of it like a decoy. It's designed to look just like factor XA, so all the rivaroxaban floating around in the body binds to the decoy instead of the real thing. This completely neutralizes the drug's effect and lets the body's natural clotting process restart. It's a critical safety net when it's needed most.
And this brings us back to a quote that just perfectly sums up the two sides of this coin. Its power to prevent clots is directly linked to its risk of causing bleeding. It's an incredibly powerful tool for sure, but that power has to be respected. The entire therapy is built on that delicate balance. So we'll end with this thought. Rivaroxaban is without a doubt a huge leap forward. It's simplified life for millions of people, but it also shines a bright light on one of the greatest challenges in medicine, finding that perfect balance point. It's just a reminder that even as our medicines get more advanced and more targeted, they still require careful, smart management, making that partnership between an informed patient and their doctor more important than it has ever been.